Welcome to the St. Stephen's Community House Crystal Methamphetamine e-learning series. This is Module 2 of 4. We all have a role to play in recognizing the worth and value of people who use crystal methamphetamine, wherever they may be in their journey.
What does stigma look like? Stigma looks like the doctor who, when signing my medical forms for my first treatment facility, said to me, "You're lucky to have all of your teeth left," and then told me stories about how crazy people on meth were. It looks like the dental hygienist who, when I disclosed my use, proceeded to tell me, "Oh, you really have to stop that sometime soon. It's awful." Being told I was stupid for using, the rejection from my family and loved ones at each disclosure of use, the endless worry if I missed a day at work or was honest with someone that I would lose a job or I would lose a relationship or that people would make assumptions about me because I was a crystal meth user. Webster's defines stigma as a mark of disgrace associated with a particular circumstance, quality, or person. For me, stigma can be summarized as prejudices, judgments, and a lack of empathy resulting in people becoming something less than human in others' eyes. It's problem embodiment. The person is the problem, and a personalization of their behaviors. So what this results in is an othering that creates barriers and results in poor treatment of individuals or groups of individuals in society. Barriers can be visible, such as being banned from a business or a drop-in, or they can be invisible. People being rude when it's not called for or making comments that aren't appropriate. Stigma around crystal methamphetamine use can be seen in our current drug laws, which perpetuate the criminality of people who use crystal meth, popular media representations of people who use crystal meth, like Breaking Bad, Family Guy, where crystal meth users are always seen as mentally ill, picking at their skin, engaged in inappropriate behaviors, and almost always living in poverty, homeless, or underhoused. News sources misrepresent crystal meth use. For example, in 2005, when Newsweek identified the meth epidemic as America's new drug crisis in a sensational cover story, illicit methamphetamine use had been declining for years. In the National Survey on Drug and Health, the number of respondents who reported consuming meth in the previous year fell by about a quarter between 2002, the first year the survey was conducted, and 2005, when Newsweek cried epidemic. Data from the National Household Survey on Drug Abuse, an earlier version of the NSDUH, suggests that meth during this period peaked in 1999, 6 years before Newsweek discerned a new drug crisis. Stigma can be seen in language like tweakers and meth heads, healthcare professionals, and their modes of thinking around addiction and addicted persons, unconsciously or consciously withholding treatment, not giving all the necessary information, or only treating substance use, whether the person wants it treated or not. Stigma is intimately linked to other forms of systemic oppression. For example, racism, homophobia, poverty. Assumptions and stereotypes are closely linked. Stereotypical thinking and making assumptions supports people to behave in stigmatizing ways. Common assumptions about crystal meth users include people who use crystal meth think it's the worst issue in their lives. People only use crystal meth because it's cheap and lasts longer. Once you use crystal meth, you're hooked for life. That crystal meth is more addictive than other drugs. And that addiction is a choice, and so if someone's treated badly, they're to blame for it. Examples of stereotypes include crystal meth giving you a lot of energy, which is why it's used by people going to raves or dances. People who use crystal meth all pick at their skin. Gay men want to use crystal meth primarily because it enhances sex. Young girls use crystal meth to suppress their appetite. And long-haul truckers use crystal meth to stay awake. Fundamental to stigma is the power difference between the person being stigmatized and the stigmatizer. What are the impacts of stigma? Stigma is internalized by people who use crystal meth. The stigma can result in secretive and antisocial behaviors associated with use, and it can mean there's a difficulty in connecting with supports for fear of judgment, rejection, and the rejection can be real or perceived, or mistreatment.
Do some self-reflection. Where do you get your ideas about people who use crystal methamphetamine from? Are they shaped in any way by the media, your life experience? Do you remember the courage it takes to disclose drug use? Honor that individual and say thank you for it. Nothing more is needed than to be heard and seen without judgment or comment. Do you ask yourself, is this the time or place to delve deeper into someone's use? Do you ask yourself if talking to someone about it is even in scope for your interaction? Do you see substance use as a coping mechanism like any other? Coffee, cigarettes, a glass of wine, or a trip to the mall? Do you increase your knowledge of crystal methamphetamine and its effects, which you're doing today? So thank you. Do you focus on building respectful and trusting relationships with clients? Do you use neutral, non-judgmental language? Do you advocate on behalf of clients to ensure that they get the services and resources that they are entitled to? Do you challenge drug-related stigma and discrimination when you see it? Do you advocate for systemic change? Health, housing, employment? Do you participate in networks advocating for evidence-based drug policy? Don't use language like meth head, tweaker, spun. These words have shame attached to them and reduce people to stereotypes. Don't assume a person needs to stop, should stop, or wants to stop their use. Don't assume violent, psychotic, or aggressive behavior until given reason to suspect this may occur. We'll dive more into this in detail in Module 4.
You can help reduce stigma of your clients and people who use crystal methamphetamine at your work. Some of the things you can do include asking leadership about getting more anti-stigma training for all staff, or starting education campaigns at work and looking to spread those campaigns to service providers, partners, and others. You can also counter stigma by talking about it whenever you get the chance. Role model times that you've been stereotyped by others and how you might have challenged yourself. Support peer programming at your workplace, where peers are hired to support people who use crystal methamphetamine, and to be the key voice in education campaigns. Reduce stigma further by adding discussions about stigma and discrimination as a standing item to team meetings, or by creating a staff group to identify and address service barriers and challenges. You can find examples of anti-stigma campaigns on the internet. Just Google anti-stigma campaigns and drug use. A wonderful example is called Stop Stigma, Save Lives, created by the Northern Health Authority in British Columbia.
If there's one message I want to convey to you, it's to check your assumptions. Ask yourself, is this the right time, place, or reason to discuss crystal meth use with the individual in your care? If you can say yes to those three things, you're helping to undo stigma and support the individual you're encountering. If you do feel it is the right time to talk about it, be respectful. Ask if the person wants to talk. Check out your language. Ask how they want their use to be referred to in the conversation. Don't assume they want to be called an addict. Don't assume that their problem is just crystal meth. Don't ask questions unless relevant. So, do you really need to know the last time someone used when they're waiting to get food in the lunch line? And don't be afraid to ask what the right thing to do is. A final word. See the person first. See the substance use second. Stigma is felt so deeply because fundamentally we're social in nature and we value the opinion and approval of others. The root of stigma, which is in assumptions and blame, makes it difficult for users of crystal meth. The use of crystal meth is a more complex than societal assumption and blame applies. Lastly, drug users' lives matter, whether they're in recovery or not. Again, drug users' lives matter.
We are grateful to the Toronto Central Lynn and University Health Network for funding this project.